Hi guys, welcome back to the channel. Today we are going to do day 2 for practicing NREMT questions. So today we are going to do questions on resuscitations. So let's dive into it. Question 1. Your patient is a 66-year-old female who has regained a pulse after a shock with an AED. However, she remains unresponsive and is not breathing adequately. Which of the following should be done next? So we have apply a non-rebreather mask with high concentration oxygen, keep reassessing, remove the AED, assess the patient's ventilation with the big valve mask, and supplement reassessing the pulse. It's just perfect. Supplemental oxygen and reassessing the pulse. Ventilate the patient with high concentration oxygen, transport immediately. Deliver a fourth shock to improve the patient's respiratory state. So in this thing, we'll just ventilate the patient with high concentration oxygen and transport, because we are not that much qualified to remove the AED or stop the AED or all those things. So we just keep the AED on, hyperventilate the patient with high oxygen and transport them, so that we just EMS doctors can see and take over. Removing EAD, we should never do it, and applying non-breather mask is basically not enough. You have to do CPRs, and you have to just with the oxygen, because CPR is like helping the heart mechanically to pump. So doing CPR, ventilating, putting AED, everything we have to do it together. And still, if we are not having anything, we can't tell that the patient is dead, or we can't remove all these things. We just have to transport as an EMT and then give it to the doctor, the PCR reports and all that. Okay, then we go to question 2. What does ventricular fibrillation do? So what is ventricular fibrillation? Basically forces the heartbeat to become quite rapid. So that is not fibrillation, it is just tachycardia. Causes asphyxial cardiac arrest. So ventricular fibrillation is different than cardiac arrest. Prevents the heart muscle from contracting. So yes, that's ventricular fibrillation. Initiates a commotion cordis. So that's not correct. So yeah, basically ventricular fibrillation is that your ventricular muscles, so basically the blood in the body goes to the ventricles. So ventricular fibrillation is that the heart is not pumping, the muscles are not contracting, and it's not going to your body. So heart muscle from contracting normally, ventricular fibrillation prevents that. Okay, then we go to question 3. You're on the scene of a 64-year-old female patient with a cardiac arrest. Age always matter, because older people, it is more susceptible to see an heart attack than younger patients. So yeah, it's 65-year-old patient with cardiac arrest. CPR is in progress and AED has been applied. The AED does not advise a shock. What's your next intervention? Insert a combi tube, replace the malfunctioning AED, continue CPR, stop CPR, and place the patient in the recovery position. So in this thing, when AED says shock is not advised, basically your AED itself will speak to you and tell you just continue compressions, shock not advised. So in real scenario, you'll know it, but on exam you should know you should never stop giving CPR. If shock is not advised, continue giving CPR. And it's not important, maybe your AED is malfunctioning, but you can't just deduce that your AED is malfunctioning because it is not advising a shock, because sometimes shock is not required. Because why you think the shock is needed? The shock is needed just to refunction and restart the heart. So we give a little shock to the heart so that it starts again. But if the heart is working fine, there's some other problem with the heart, then they'll just say to continue the CPR. That would just help the heart compress and release. Okay, So just continue CPR was the answer. Then question 4. Which of the following best describes an appropriate shock sequence for the patient in ventricular tachycardia? So what's ventricular tachycardia? These kind of terms are important for EMTs to know because it's easier to, communicate with medical professionals, and maybe like if you're just reported that there's a patient with a tachycardia or something, you should know it. Like nobody will be there in the real time scenario telling what is tachycardia, heartbeat is low and all that. You should know tachycardia, bradycardia and all that. So ventricular tachycardia is when your heartbeat is very fast. Tachy means fast, brady means slow. So ventricular tachycardia is when heart is beating very fast. So which of the following best describes an appropriate shock sequence when your heart is beating too fast and it's in ventricular tachycardia? So first you give shock, then pulse check, then shock, then pulse check, then shock, then pulse check. Or you do shock, 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 then pulse check, then 2-minute CPR, shock, shock, shock. Or you do only shock, 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 which is obviously not correct. And or shock, then 2-minute CPR, reanalyze, shock again. So basically when you connect the AED, because obviously AED will give the shock, it will tell you how the sequence works, but you should know. First, whenever you see a patient unconscious and you suspect it's a heart attack, just start doing CPR and tell somebody to grab you an AED. Then put the AED, then AED will be like, leave the patient, let me assess the patient. So it will assess the patient, what's going on with the heart and all that. Then it will say, shock advised, stay away from the patient. Just get away from the patient, give the shock. Then it will say continue compressions. So you do 2 minutes of compression CPR. Then machine will again say, the AED machine, that shock advised, remove from the patient, reanalyzing. Get everybody off the patient. Then it will just reanalyze. And then you just press the button, it will administer a shock. Then again you give 2 minutes CPR, and this minimum you should do for 20 minutes. Okay, so and while you're reanalyzing, machine is reanalyzing, but you should also reanalyze. You can just check the pulse from here and see if the person has started breathing normally. So this is the appropriate way of doing it. Okay, usually AED will let you know like what's the general position process, because you can't give shock without AED. If you don't have AED, you're just doing CPR and you're just taking the patient to the hospital. But generally EMTs will have AED machines in their bag, so just put the AED machine, it will guide you everything that you have to do. Then question 5. You are preparing the patient in cardiac arrest for an AED when you palpate a small lump below the patient's clavicle. How should this modify your placement of AED? So while placing the pads in general area, you need them. Keep them several inches away from the lump. Okay, so that's the correct way. It's pretty common sense that if there's a lump, you won't place the pad over there because it's giving shock. And if there's a lump between the skin and the internal things or the muscle, the shock won't go to the heart, right? So you want the shock to go, whatever the shock capacity is, it should go to the heart. So you don't want any interference in between. So if there's a lump, just place it several inches away from that, so that there's no obstruction in between the shock that's AED is giving to the patient. Okay, let's do question 6. Mechanical CPR devices are used by EMS agencies in order to provide. So basically you can give CPR with your hand, but there's like a big machine which gives CPR to patients. So why are those CPR machines used? So these CPR machines are used because sometimes when humans are doing, they get like tired, and they can't like do the quality CPRs. So to give high quality compressions during the CPR, they use mechanical CPR machines. Okay, Let's do question 7. In which of the following ways does cardiac arrest in children differ from cardiac arrest in adults? So cardiac arrest in children is more likely to be due to respiratory failure, okay? Because children, their lungs are not developed that much, and mostly they breathe from their mouth instead of their nose. So when something is like curdled in their mouth, maybe food or something, there's the respiratory failure and there's lack of oxygen, and then heart just stops breathing, like pumping and putting the blood in the body because there's less oxygen, right? So in children, mostly it's due to respiratory failure. Then let's do question 8. All of the following are elements of adult high performance CPR except. So compression rate of at least 100 per minute, so that's correct. Placing a heel of one hand on the center of the victim's chest and put another, so that's also correct. Maintaining a 2:30 ratio of ventilations of compression, that's correct. So, and the B option, compressing the patient's chest to no more than 1 inch in depth before allowing full relaxation. Okay, so the answer is B. Let me get an explanation for you guys. The only problem I see in this is it's not 1 inch, it's 2.5 inch. But that doesn't matter because in real life you would be doing it real hard on the patient. But I think the only problem here is it's 2.5 inch and not 1 inch. Okay. But allowing full relaxation is correct because you have to let it recoil. So yeah, B option is not correct because it should be 2.5 inch and not 1 inch. Question 9. Blunt and penetrating injuries can damage chambers of the heart or cause conditions like. Okay, blunt and penetrating injuries are like which cut through your skin. So it can cause conditions like pericardial tamponade. Okay. So what's that? Let's go and check. Sorry. I'm just bad with spelling, so I'll just copy paste it. Okay, so pericardial tamponade is a life-threatening condition where fluid accumulates in the pericardial sac, which is, if you can see, this place. So here the fluid gets accumulated because it's a blunt thing, right? So blood or something, it just punctured the heart, so then the fluid will build up and all that things. So that's called pericardial tamponade. So that could happen because of blunt or penetrating injuries. Okay. Ventricular tachycardia, as we know, just heart just pumps very fast. Ventricular fibrillation is much muscle is not contracting. Cardiac arrest is there's a problem with the electrical impulse in the heart. So the only problem for the penetrating or the blunt injuries will be pericardial tamponade, which is filling of that outer wall, which is the pericardial wall. Okay. Then last question. You're on a scene of a 68-year-old male patient complaining of a severe heart pain for last 20 minutes. He has previous history of myocardial infarction and states it feels just like the last time. You have applied oxygen, assisted him in administering aspirin. Aspirin is when somebody's having heart attack. It just, dilates the vessels and thins the blood. And nitroglycerin with no reduction in chest pain. Your nearest facility is 5 minutes away. A level 3 trauma center is 10 minutes away. And a hospital with cardiac catheterization capabilities is 20 minutes away. So you have to choose which one is better for your patient and what facilities they want. Do they want trauma center, or they want cardiac facility, or they want just normal ED stuff and all that. So you have to choose which place is right for your patient. You just can't take your patient to any hospital. The patient is requested to be transported to his cardiologist hospital, which is 30 minutes away. What will you do? So if I would be in the position, and if you are in the position, what you should do is you should go to the nearest hospital that has cardiac facilities, like cardiac catheterization. So his cardiologist hospital is 30 minutes away, but the cardiac catheterization is 20 minutes away. So there's like good 10 minutes gap in between. If it was like 30 minutes and another one is like 28 or 25 minutes, I would still be like, okay, fine, we can go to his cardiologist because he knows the history and all that. So that way it would be a beneficial decision. Trauma center is like no way, would be helpful for him because he's not into some trauma. He's having heart problems. So hospitals that has more doctors and residents that are specialists in cardiac, that is like ideal for us, and I'll choose the 20 minutes away because that's the nearest and quickest option. So yeah, the nearest hospital with cardiac catheterization. Well, that's all for today. Practice a lot, keep revising whatever it is. I'll try to make more videos about the content, but for now I was just practicing questions for my own exam, so I just extended it to you guys. Try to answer it. First read the question, try to reason it why the answer is correct, and then if you think some other answer is correct, you can totally put in the comment section and we can discuss about that. And if you have any other questions about EMT exams, how to schedule it and all that, you can just put on the comment section. I'll get back to you. And thank you guys, have a nice day, best of luck for your exam.